Hello again, guys. This is the management domain video. I hope you've been learning a lot from the other ones. If you've not watched the data gathering domain video and the relating to others domain video, please do watch them before watching this, because how will this make sense to you if you've not seen those videos? Okay, let's get into it. This is the most important domain in this exam because it carries the highest mark. So let me quickly say that why would you not prioritize the management domain when you understand that is the domain with the highest score, highest marks? How do I mean prioritize? I'm going to dial back, to the data gathering video. You have two parts of a consultation. You have the data gathering and you have the management. The IPS is a mix of both, isn't it? It's bits of, both domains, data gathering and management. So if you have 12 minutes, it only makes sense to spend half of the time, in one domain and the other half in the other domain. Why do you want to spend 80% in the data gathering or 70% and then 30% in management? You have set up yourself not to pass the management if you do this. So I'm going to say very quickly that the first nugget to passing management is having enough time, to spend or to deal with the management, because management entails not just passing textbook stuff to the patient. It involves the patient also responding and talking to you, accepting to go with an option you're offering. So there's a lot in management, but let's get into it. The first point, make it a habit to always put always in capital letter, or should I say, you must list your management options. Let me tell you what I mean by that. If, for instance, you have done all the data gathering and you've seen that someone has maybe COPD, you cannot assume that what the patient wants to hear is the medication for COPD. So you would not want to start your management by saying that there are medications, the name of the medication is this is what the medication does. That way, you set yourself up to probably not pass the management so well, or not pass it at all, or you might have set yourself up, to not pass the relating to others. How do I mean? If the diagnosis is clear to you and you want to start the management, it takes nothing to list the options of management. When the patient says, okay, so doctor, what are we going to do about this? You say, that's a good question. There are a few options available to us, Sam or Joan. And then don't forget that listing, I use the word list. So you should list. Do not explain the options yet. Say, for instance, there are tests we can do. We can discuss some medications that could help your condition. We can discuss lifestyle changes to help prevent these things from happening. And we can also discuss some social issues that have come up. And for some cases, we can discuss referring you to specialists or other members of the team, or getting them involved in your care. Let me run that again so that you will get it. It's really important. In the management bit, you need to be methodical. And one thing I should say is your plan or your goal is not to explain everything, or is not to discuss every section of the management. Your goal is more to demonstrate, number one, help the patient understand all the available options. That's the most important thing. the role player, understand all the available options. Number two, because 6 minutes is not enough for you to explain all these options in detail. It's never enough because you are not going to be what's the right word to use? You're not going to be to do a presentation to the patient. It's not a presentation. It's telling the patient what you've, in your own view, will solve their problems and helping them make a sense of it and having an informed decision to make their choices. That's what management is about. So let me run through the listing again, because that's probably, this is probably the most important part, in my own view, of passing the management. Once you know what's going on with the patient, you need to tell them, you need to give them the highlights of what can be done. One, not these options I'm reading out are not applicable in all cases, but in most cases, some of them are applicable. And they're default for me, by the way. The options we can discuss tests that we can do. We can discuss medications that can help with your condition. We can also discuss some lifestyle changes that can help. And we can discuss some social issues that have come up in the course of our of this consultation or conversation. And we can discuss referring you to specialists or involving other people in your care. So you see, that's like unbundling it. I said the first advantage is that the patient now has a bird's view of everything that you want to discuss with them. More importantly, because it's an exam, don't forget, the examiner knows that this guy knows, or this lady knows what they're doing. That is, this lady knows, or this gentleman knows all the aspects of the management. Because if you've listed, that means you know it. It's presumed that you know it. The only thing you then need to prove to the examiner is that you know it properly. So you're going to be doing what? You're going to be expatiating on the ones that the patient wants to hear about. And this is why I say that you offer the patient right to choose before explaining any parts of the management. You offer the patient the right to choose before explaining any parts of the management. How do I mean? You cannot just start by saying there are medications and start reeling out the medications. How do you know that the patient wanted to hear about the medications? Let me tell you the other danger or the risk in just starting wherever you want without listing first. You may end up not talking about a critical point that is written in the patient's notes, in the role player's notes. But if you've listed the management options, the role player will lead you to the ones that are written down in their notes. And that's what you want, isn't it? Because if you've addressed the management aspects that is written down in the marking scheme, then you would certainly pass if you've done it well, by the way. So the first and most important thing, in my own estimation, is, first of all, listing. I'll quickly issue a disclaimer. You may not every station requires listing. Some stations just require conversation. But let me tell you, without any doubt in my mind, that 80% of the cases you're going to encounter in the exam would require you listing first. This point I've just made is arguably the best guarantee to passing the management domain of every station in the SCA exam. That being said, let's go to the next point. Categorize or structure your management and be clear about the option you are discussing at every given time. I've had the opportunity of listening to people and role playing for people, and I see this to be a major problem. If I, as a doctor, am not able to tell which option you're elaborating on for me, you can imagine the patient will not understand it at all if a doctor is not clear. So you need to be very clear and crystal clear on the aspect you're discussing. For instance, you've listed their tests, there's medication, lifestyle changes, social issues, referring to specialists. What you're supposed to do next is ask the patient, which of these options would you like me to discuss further? Or which one would you like to hear about? And the person would make a decision and say, oh, I think I want to hear about the medication. This is one important thing I should quickly say to you, and don't joke with this. If they give you a blank check, because it does happen in some stations, they'll say, doctor, anyone, you can start with anyone. Please, 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 please. I mean, it's really important for you to note that medication is probably one of the most important options in every station. They want to know, the examiner wants to know if you know the medications that will solve the problem. So I would encourage you to rush and pick medication. There's a caveat. During your data gathering, you would have asked the role player about their expectations. And probably they've told you that I want stronger medications, or I want some tests to find out what's going on with me. In that instance, if the role player says to you that when you ask them, where would you like me to start from, they say anyway, refer them back to their expectation. You say, oh, because you mentioned earlier in the course of our conversation that you wanted to know what tests can be done to find out more about this, why don't we start with that? And they'll say yes, 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 yes. Or you mentioned earlier that you're hoping to get some medications that would help solve this problem. Oh yes, why don't we start from that? Can you see what I'm talking about there? It then runs, not only are you communicating with the role player, you're also communicating with the examiner, who then you are reminding the examiner that this was the patient's expectation in the data gathering. The examiner say, oh, yeah, which then means that, oh, you've done some active listening and you are now addressing those expectations. So, however you want to do it. But one thing I'll quickly say, that many people, falter on, I have faltered on those things. Please, when I say categorize and structure your management, it's not nice when you've chosen to, or when the patient has said, okay, I want to hear about the medications. Sometimes there's more than one medication that helps a particular condition. You now talk about one of it, and then you now go to lifestyle changes, and it's oh, by the way, there's another medication. It's not nice. That's disorganizes the structure of your management. That may annoy the examiner. I'm so sorry using the word annoy, but when I say that may reduce your score, that may cost you your relating to others, because that's not good human relations. You can imagine talking about an aspect of something, then leave it halfway and then go talk about something else, and it's not tidy. So when I say categorize or structure your management, what I mean is do it in a tidy way. Let me give an example. Somebody has gout. The diagnosis is gout. You now say, we can discuss medications, and say, yes, I want to hear about the medications. When you say you want to give colchicine, whatever, to treat that episode, don't go to lifestyle that don't eat red meat and so on and so forth. No. Think in your mind critically that what medications are involved in gout, and deal with all of it comprehensively. If, for instance, the person is on thiazide and you say we want to discuss medications, you talk about colchicine, you explain what it does and why it's used as a treatment of the flares. And then you say there is yet, and of course, in your management, I keep saying that this is part of the IPS, by the way. When you've explained the way to explain it, in another video, we can elaborate on these things because we can't spend too much time, detailing it today. So, if you've told them there's colchicine, the key things when you want to prescribe any medication is the safety of the medication and the efficacy. What do I mean by that? The efficacy is just the fact that it's going to help them. You see, I mentioned earlier that the joints, crystals gather there and all of that is causing pain, swelling. So when you say you're giving colchicine, you say that this settles the inflammation that's going on. So the swelling would go down, the redness would disappear, and the pain would improve. That is the efficacy. You're telling them what the medication, you just don't say that, oh, this medication is good for gout, period. Who does that? And tell you what, a lot of us do that. I did that, by the way. So I'm guilty in all of these things. And because of that, realizing these flaws, and that's what helped me to improve. And that's why I'm doing this for you. In it. So you explain why you're giving him medication. And if you've watched my Relating to Others video, I said explain the diagnosis properly. You can imagine if you've not explained gout properly, you're going to run into trouble telling the patient why they should choose colchicine. You can imagine you've told the person that gout is a condition that affects the joints, most notably, the toe, the big toe, and this is why you're experiencing this. What happens in brief pathophysiology is that there's accumulation of uric acid crystals, which can be found in things like some food we eat, such as in your own case, you love eating red meat or seafood, or you're drinking lots of alcohol. It now causes accumulation of the uric acid in the joints, and this irritates the joints to cause inflammation of the joints. Inflammation has occurred. That's why there's redness, swelling, and pain that you're feeling. You see, you've done a bit of pathophysiology, a little bit of that, not too much. Make it very brief. You can even make it, if we are endowed with better English than mine, if you have a better command of English, good for you. Then you can make it tidier and more brief, in explanation. As much as possible, practice so you can be brief in your explanation. Then you say, if left untreated, your pain, would continue to be there and affect your quality of life. And long term, it can cause destruction of the joints. When you say things like, but we don't want that to happen to you, therefore, there's treatment. So having explained your diagnosis properly, that is, you've told them what it is, you've told them the likely cause, you've told them the pathophysiology, you've told them the complications, and you've told them there's treatment. When you now get to management domain and you want to talk about the treatment, it then makes better sense to them. I hope you go back to watch the IPS video for this to make sense to you, what I'm talking about. Then you would say to the patient, remember that I told you earlier, that there's inflammation in the joint. You don't need to elaborate anymore. You see, this medication now settles that inflammation, isn't it? By reducing the pain, redness, and swelling. And that is why colchicine is good for you. The person will now think about it that, but there's another part of what you told the person. Remember that there's accumulation of uric acid. How do you get it away? One, prophylaxis. So this is where you talk about prophylaxis. Where I am, so that I don't want to confuse you. Categorizing or structuring your management. You have to talk of all the medications. You've talked about colchicine. You want to talk about, the other medication that's for prophylaxis, isn't it? Allopurinol. You don't have to give it during the acute flare. If you don't have to give it, you can say, although this will be given to you at a later point, but to prevent recurrence of the flare. And also, you have the opportunity to go to the lifestyle. He's drinking alcohol, which is a risk factor for frequent flares, for accumulation of those crystals. You're going to talk about red meat, isn't it? And those sort of things that are risk factors in the lifestyle. I will go into that later. So categorizing, and the person is on benzoylmethiazide. So while you are in the medication option, you talk about colchicine, you talk about allopurinol, and then you talk about the benzoylmethiazide that they're on. So that's completeness. You finish talking about medication that will probably need to switch you. I do appreciate that this blood pressure medication has been controlling your blood pressure so well. But here's the challenge. it's probably predisposing you to these frequent flares of your gout. So in my own mind, I'm thinking maybe if it's to switch to another medication that could equally help with your blood pressure, that would be in your best interest. Because if you were to continue on this medication, you would have frequent flares. Does that make sense to you? That's what you say to the patient. Does that make sense to you? Or do you agree to that? Or what do you think? What are your thoughts about that? You see? And then are you happy for me to switch to the other one, amlodipine or whatever you consider the next best choice option? So you've conclusively dealt with medication. You don't want to go to lifestyle changes that stop eating red meat and so on, and then come back and say, oh, by the way, there's allopurinol. It doesn't mean you're not going to pass. I'm just saying that it will be tidier and you would be more assured of a pass in management. Let's quickly go to the next thing. I've said it anyway. After explaining an option, always ask about the patient's thoughts or opinion if they're happy to try that option. That is critical. Let's go to the next, point. Do not tell patients to change their habits, their lifestyle habits. You've mentioned that there are options. There's medication, there's lifestyle habits. Now, when you get there, I'm going to explain this to you very quickly without waste of time. Do not say to the patient that you should stop smoking or I would recommend that you stop smoking. No. You can still pass if you say that, by the way. But you want to definitely pass. Because some people might not like that. Because the patient might even be a little bit aggressive or antagonistic to you and say, I can't stop for this reason. But there's a nicer way of doing it. You let the patient make that decision by themselves. And the nicer way of doing lifestyle changes, the main things are alcohol, smoking, recreational drugs, diet, exercise. It's about the same way. You apply them the same way. What you do is tell them the consequence of their lifestyle habits. We're still on gout. So, Sam, you told me earlier that you drink lots of alcohol. The problem with that is that alcohol is known to be a common trigger of this condition. It will cause you recurrent flares. We may be giving you these medications, but if you continue drinking, you're likely to have frequent flares. What do you think? That's what you're going to say to them. Or what do you think you can do about your drinking? You've told them the consequence of the drinking. The same applies to smoking. Someone has Raynaud's. You say to them that you mentioned earlier that you smoke 10 a day. The challenge with that, Joanne, if I'll be honest with you, is smoking can narrow the arteries or can stiffen the arteries that supply blood to the hands. When this happens, you don't get enough blood supply. That prevents good circulation into the hands. And this may contribute to worsening of your symptoms. That is the consequence of the smoking. Then you ask them, what do you think you can do about the smoking? Now, let me quickly say this. They don't have to agree in the exam or even in real life to stop a bad habit. Or don't let me call it a bad habit, because it's arguable. There's some benefits of smoking to some people. Maybe that's what's putting their mental health in shape, or the drinking. You never know. So there's risk versus benefit, but that's not yours to discuss. Yours is to try to convince them, to improve on their lifestyle habits as it relates to their condition. Just give them the information. What they say to it does not matter. Of course, it does matter, but what I mean by that is it's not for you to compel them to stop. If they say, if somebody now responds to that, man, this smoking is my guilty pleasure, I don't think I can stop it now. Let me tell you what, it's an exam. Don't waste your time. Just say, I hear you. And I know that sometimes these things are difficult to give up. But if you do change your mind, we can offer you some services that can help. Does that make sense? They'll say, oh, okay, 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 okay. They won't even fight you. So if you do change your mind, there are services we can refer you to. Don't waste time about elaborating on those services. That's not the core. That's not what they're trying to mark in the exam. So just to leave that, the next point is do not ever plan to have a clear pass in any domain. People look at me with strange eyes whenever I say this. Let me tell you what, guys. Your one and only plan is to pass every domain. I did not plan to have any clear pass in any domain. I made up my mind that there's no need to chase a clear pass. Let me tell you the problem with that, because I chased after clear passes in previous exam I did before this one. When you're chasing a clear pass in data gathering, for instance, you will remember what you've not asked, and the time is ticking. Then you get to 7 minutes, and then you remember what you've not asked, and then it gets to 7 minutes 30 seconds. Ooh, I've not asked this all important question, and then you get to 8 minutes. Let me tell you what, they may hand you your clear pass in data gathering. But let me tell you what, no matter how clever you are or how cleverly you dealt with the management aspect, it is likely to be a fail. So, the question I asked myself when I was doing the last exam is, whenever I got to 6 minutes in data gathering, and then I asked myself, not that, it's just critical thinking, do I want to pass the management? The answer was always yes. But you should ask yourself, when you are 5 minutes 30 seconds in data gathering, you call your name. I call my name in my head, Akin. Do you want to pass management? Do you know what my head tells me? Yes. So if I want to pass the management, then the next thing is to move. Abandon whatever is left. Read my lips. When you've got to 6 minutes, abandon whatever is left. Wrap it up. That's why I said 6 minutes 30 seconds maximum. Wrap it up and abandon the rest. I abandoned the rest, and I passed 90% of my data gathering. I abandoned the rest. I won't go into data gathering. Go and listen to it so that you know how to pass the data gathering. It's not about ruling out that makes you pass the data or the number of questions you ask. No. You gotta give time for your management. Quality time. You need 5 minutes, thereabout. So if you finish 6 minutes 30 seconds, use 30 seconds to 1 minute to explain the diagnosis properly. Don't be in a hurry to explain the diagnosis because it has implications in management. I want to wrap it up before 30 minutes. So the last part, which cannot be overemphasized. You may not like it, but you better like it for SCA exam. Do not ever bring anybody in for examination. I will say it again. Do not ever bring anybody in for exam. The SCA exam is designed for you to manage the patient fully without bringing them in to examine them. It's a no-brainer. You already know that. Why would you say to someone that it will be helpful to bring you in for examination? Even if they are having exacerbation of COPD, it's common sense. It sounds plausible that, I want to listen to their chest to be sure that they're not having a bad wheeze. But tell you what, let me quickly counter that argument. You are looking at them in the video, in the exam, and see how I'm talking to you. If I told you I had an exacerbation of my COPD, do I look like I'm dying? So why do you want to listen to my chest? If you think I have an exacerbation of COPD, why don't you issue the prescription to me and tell me how to prevent future flares? This is what the exam is about. Do not see, when you mention that you want to bring someone in for systemic examination, you waste your time in management because they would reject it. Some people don't reject it, they allow you to bring them in, but they won't score you for that. I know they won't score you for that because they've given you enough information to manage the patient. I would end it here. If I need to do, a more comprehensive video or other parts of, examination, I can do that. But I hope these few points would help you ace your exam. Thank you very much, guys. Love you all.